The low FODMAP diet for gut healing, science, and dietary protocol. If you're experiencing gas, bloating, pain, bowel irregularity, perhaps fatigue, brain fog, insomnia, even skin issues or joint pain, this could indicate that a gut issue is underlying these symptoms. And given the fact that 40% of the US population has some sort of gastrointestinal issue present, it makes this a fairly salient point and something that we want to cover. A low FODMAP diet can help heal your gut. And so let's cover a few what I feel to be very important studies that you should know about, illustrating the reparative ability of the low FODMAP diet. And again, remember that an unhealthy gut can cause a wide array of symptoms. So if you can relieve or repair a problem in the gut, you may resolve many pain points, brain fog, insomnia, bowel issues, etc. So let's review the data and then give you guidelines for how you can do a low FODMAP diet trial on your own. So we've established that a low FODMAP diet can be reparative. One of the ways the low FODMAP diet is reparative is through correction of leaky gut. And there are two studies here that I wanted to share to help you see that there is good scientific evidence documenting that a low FODMAP diet can repair leaky gut. This first study comes from the Journal of Clinical Investigation, a 4-week period on a low FODMAP diet in patients with IBS. And what they found, I'll share an image here, but I'll also narrate through it for those just listening, is a reduction in fecal endotoxin, aka LPS. And the data you're looking at here is the fecal endotoxin, or LPS, lipopolysaccharide, the component of a bacterial cell wall that when it leaks through the gut can trigger inflammation. And we'll come back to and tie in inflammation and the immune system in a moment, but let's start with leaky gut. Healthy controls had a lower level of leaky gut than did those with IBS, irritable bowel syndrome, abdominal pain, gas, bloating, altered bowel function. Not surprising, right? If you have all these gut symptoms, it would make sense that you have a significantly higher level of leakage of leaky gut as measured by this endotoxin. So this is a measure of direct leakage of particles through that membrane in the small intestine. And here's where the story gets interesting and hopeful. When the IBS cohort went on a low FODMAP modification, their levels of LPS was essentially the same as healthy controls. So a vast reduction in the level of leaky gut of LPS when going on to a low FODMAP diet. And this was documented in as little as 4 weeks. The next study, same point, but another trial to help us really see this isn't just one study cherry-picked, comes from the journal Nutrients. In this case, 12 weeks on a low FODMAP diet in patients with IBS again. And what they documented was a reduction in serum zonulin, a reduction in LPS, so the direct leakage measure, a reduction in serum DAO, or diamine oxidase, and a reduction in IL-6, the inflammatory cytokine. Now, a really important point here is while they did show a reduction in serum zonulin, there was no change in stool zonulin. We covered a meta-analysis on the podcast previously looking at probiotics and how probiotics could resolve leaky gut. But in that meta-analysis, which I believe was of 22 clinical trials, they did not find that stool pre-post zonulin testing correlated. They did find that blood correlated. Why this is so incredibly relevant is stool zonulin testing is ubiquitously performed in the field. And I've been saying for a while, we are strongly questioning how helpful these tests are. In fact, the recent video wherein we took the same stool sample, put it in 2 different functional medicine stool tests, and demonstrated or documented vastly different results. So, key point here, if you're looking to do repeat stool zonulin, you're wasting your time and you're wasting your money, because we're seeing more and more evidence accrue showing that stool zonulin does not seem to correlate with the leaky gut being resolved. So that's key point 1. Key point 2, just in case this is confusing, DAO, diamine oxidase, breaks down histamine. So we want to have robust levels of diamine oxidase, of DAO, but you want it in the lumen of the gut so it can digest the histamine. You don't want it leaking into the bloodstream, and when you see high serum or high blood DAO, that tells you that leaky gut is present. So just to clarify, we're not seeing a reduction in histamine digestibility. In fact, I'll share with you a study later that documented improvements in histamine levels and also mast cell activation. So a healthier immune system, if you will. The DAO here is meant to illustrate a reduction of leaky gut. So one more trial documenting through multiple measures, serum, blood zonulin, not stool, LPS, the actual leakage, DAO, another form of leakage, and interleukin-6, an intermediary inflammatory cytokine. Okay, so pretty compelling data, thankfully, that shows us a low FODMAP diet in anywhere from 4 to 12 weeks can start to resolve leaky gut as measured by multiple metrics. Okay, so this is great. Now let's build the story a little bit further, because leaky gut doesn't just happen arbitrarily, right? An unhealthy gut doesn't happen just randomly. There are initiating factors. Now, many of these you probably know, but just to restate a few of them. Antibiotic use. Now, if you need an antibiotic, you should use one, but this is one risk factor. Not being breastfed is another as a child. High stress, poor sleep, a Western diet, a high consumption of alcohol, and even interestingly, from a recent meta-analysis, chronic use of decongestants. In fact, in this one study, they found that chronic use of decongestants, these sympathomimetics that sort of are stimulating but can decongest you, led to more dysbiosis than did acid-lowering PPIs or antibiotics. But without getting too far afield, these factors can predispose you to development of dysbiosis and of SIBO. And these are 2 factors that can really drive leaky gut. So these unhealthy behaviors lead to leaky gut, but in between these 2, what happens in some cases is the development of small intestinal bacterial overgrowth and or a skewing of the populations of bacteria known as dysbiosis. So let's now discuss how the low FODMAP diet can resolve SIBO and dysbiosis. The first trial here I wanted to share comes from the BMC Gastroenterology 2021. It's a clinical trial, and what they found in this 6-week intervention that was both low FODMAP and gluten-free, so we should be a little bit attentive to that detail. But they found reduced fecal calprotectin, and that's what you're seeing here. So pre-post calprotectin, and for those of you just listening to this, there's a vast, significant reduction in the levels of calprotectin in the stool. And this is an inflammatory marker, which is not diagnostic to IBS, it's diagnostic to IBD, but nevertheless, it's interesting to see a reduction in this inflammatory marker. But more importantly, the thing that I wanted to share with you the most was an improvement in dysbiosis. Now, how do they quantify this? How do they qualify this? Well, there was an improvement in an increased level of lactobacillus species and bifidobacterium species. while concomitantly there was a decrease in the levels of pathogenic bacteria. So this one trial, 6 weeks, low FODMAP plus gluten-free, reduction of inflammation, and most importantly, an improvement in dysbiosis. Now that's not it. There's another trial here that just recently came through our feed that I think is cause for, celebration as it pertains to the low FODMAP diet in the treatment of SIBO, or small intestinal bacterial overgrowth. Because sometimes you'll hear what I think was a well-intentioned, but perhaps now slightly antiquated perspective that, doesn't the low FODMAP diet just manage symptoms? And it was debatable for a while. My thinking has always been, my position has always been, if a diet feels good to the individual, if you have less symptoms on a diet, it's likely going to be reparative and corrective. So when we have no data to answer the question one way or the other, I'm assuming if you come back after 4 weeks on a diet and go, geez, doc, my bowels are better, I'm sleeping better, I have a better mood, I'm going to assume that that diet is correcting a number of biomarkers, and I care more about your symptoms than I do about the biomarkers. But nevertheless, now we have data from the journal 2023 Digestive Diseases that in 2 weeks, you can see a marked reduction in the SIBO positivity rate. And that is this next graphic here. So what you're seeing is a 30% improvement, again, in SIBO positivity after 2 weeks on the low FODMAP diet. They compared that to the other bar in the bar graph here, showing a 40% improvement when the low FODMAP diet was used with probiotics, which is one of the most common recommendations we make. Start with diet and then layer probiotics on top of that if you're not seeing or experiencing full resolution. And what a beautiful study documenting the sort of rhythm we've fallen into clinically. Start with diet and then consider layering on other therapeutics, most namely probiotics. So again, a 30% resolution or reduction in SIBO positivity rate when going on the low FODMAP diet for only 2 weeks. I think this is remarkable. So in recap thus far, we've illustrated that multiple measures of leaky gut can be resolved in as little as 4 weeks, that dysbiosis can be improved in a number of weeks, and also that you can reduce SIBO in as little as 2 weeks. So great data here illustrating how helpful and reparative the low FODMAP diet is for your gut. By the way, everyone, if you're enjoying this video, please comment. I always learn a lot from the engagement there. And if you want to hear more content like this from us, please subscribe. Now, the final point or points here I wanted to share tie in with the immune system. Because if we're seeing improvements in leaky gut, we should see improvements in the immune system. And we've already seen a hint of this with the improvements in the inflammatory cytokines. Okay, but let's look at this more directly, because one of the, I feel, underappreciated components of how problems in the gut cause what feels like symptoms of chronic inflammation is due to the immune system inflammatory tie-in into the gut. So if you're having joint pain or just a feeling of being foggy, or even a feeling like your gut is inflamed, right? This can literally be due to the immune system in the small intestine being overactive because of that leakage. So this next study, 2021 clinical trial in the JCI journal, 4 weeks on a low FODMAP diet. They found, coming back to that previous marker, a reduction in serum blood histamine. So you don't want, remember, high blood histamine. You want robust histamine in your lumen to digest histamine. I'm sorry, you want robust DAO enzyme to digest histamine, but you don't want stuff that should be in the gut, namely histamine, leaking out. You also don't want systemically high histamine because this is a direct marker of immune system activation. So histamine levels go down after this 4-week intervention with a low FODMAP diet. But here's the other important factor, and I want to quote the journal here. The low FODMAP diet also reduced mast cell activation in patients with IBS, reflected by decreased serum levels of mast cell tryptase and histamine. So great news that we're also seeing histamine and mast cells improve when undergoing a low FODMAP diet. And the other point here I want to tie in, which isn't so obvious, but I think it's important to state because it helps us understand why the low FODMAP diet, in fact, can be reparative and maybe even regenerative, is this wonderful study from Tarek Mazalwi, who was on the podcast a number of years ago to discuss. I remember when I read this journal paper, my jaw nearly hit the floor because this is truly showing a regenerative capacity of the low FODMAP diet. This schematic, it might be a little bit hard to appreciate, but said simply, the dark specks you're seeing, so what you're seeing here are two histology slides, samples of the actual tissue of the small intestinal lining under a microscope, magnified obviously. And there are enteroendocrine cells in the lining of your intestine. Serotonin and PYY are two of them. And that's what you're seeing documented here, these dark circles amidst the sort of blue circles. What they found when undergoing a low FODMAP diet was a normalization of the level of serotonin and PYY cells in the lining of the gut. So in those who have IBS, IBD, they may have a lower density of serotonin cells. And serotonin helps with nociception, pain modulation, with motility, but also, I think, underappreciated is the fact that serotonin also participates in local immune defense. So if you have better immunity, so to speak, in your small intestine, you may experience all of the above that we've outlined thus far. A reduction in inflammatory cytokines, a reduction in leakage, a reduction in dysbiosis and SIBO, because remember, the immune system helps to surveil and prevent overgrowth or imbalances. And then additionally, a reduction in mast cell activation and levels of histamine. So really exciting work here showing yet another mechanism through which the low FODMAP diet is not only corrective and reparative, but again, regenerative. This brings us to the protocol, so to speak, meaning how do you do a low FODMAP diet? Well, firstly, let me say, I understand that when you go online and you search for a low FODMAP diet, you will see differing results. And this can be frustrating, and I understand that, but please know that even if you're seeing some disagreement with various dietary handouts, the overlapping 80%, let's say, should have fairly clear commonality. And what's the most important concept, in my opinion, is just reducing your general FODMAP load over time. It's not to say, ooh, if you have a little bit of FODMAP, the whole diet is invalidated. Because remember, what the low FODMAP diet is trying to do is reduce the intake of prebiotics. It's not aimed at reducing it down to zero. Maybe a crude analogy would be if you are overtraining, if you're exercising too much and you need time to recover, it's not to say you wouldn't exercise at all, but you would just need to bring your load down to one that's more appropriate so your body can balance and heal. Okay, so that's point one. Don't sweat the small stuff because that can really just derail a successful dietary intervention. If you're aiming for perfect, then that will almost for certain sideline you. Additionally, I think it's the most helpful to think about low FODMAP diets in three windows: your standard, your paleo, which will also cut out things like gluten from that other study that we mentioned a moment ago, or a vegetarian version. And we will provide links in the description so that you can click through and access either the standard, the paleo, or the vegetarian low FODMAP diet, depending on what your dietary needs are. Also, bear in mind that if this is the right diet for you, you should be seeing improvements in 2 to 3 weeks. Now, it's not to say you will see all of the improvements in that 2 to 3 week period, but you will have a sense, yes, I'm feeling better. Yes, I'm trending in the right direction. Or I feel no better, maybe even worse. So these time point evaluations are helpful so that you know, am I on the right track? Right? So the first reevaluation, 2 to 3 weeks in, if you're on the right track, if this is the right dietary change for you, you will be improving. Will every symptom be improving? No. Will your symptoms be totally gone? No. But will there be a general trend of clear improvement? Yes. Now, my observation here, this hasn't necessarily been published, is that people will see a peak of their improvements sometime at the second or third month, maybe the fourth month, but usually by the second or third month, people will see a peak in their level of improvement. This is another key time point because if you peak, let's just say arbitrarily here, 0 is you're feeling awful, 100 is you're feeling amazing. If you peak at 50%, 60%, maybe even 40%, if that's where you're peaking and you're not getting any better, that's when layering in another therapeutic like probiotics makes sense. Okay, so keep that in mind. We take a bigger picture here. It can help us see the roadmap and not get waylaid by the latest gadget or gizmo. Also, remember that you want to reintroduce later on. The low FODMAP diet, due to the reparative, rebalancing, and regenerative effect, doesn't seem to require long-term adherence. It's a corrective rebalancing protocol or dietary change. It's not a, I have celiac, I can never eat gluten again. It's really important to keep that in mind. Also, one or two other, remarks I would be remiss if I didn't mention. Be cautious of testing. Now, the clarification I always try to make here is I'm not saying if your conventional medical provider, if your gastroenterologist is saying you need a colonoscopy, you need a blood test, what have you, you don't do that. But what I am saying is, especially in the realm of direct-to-consumer testing or in the realm of functional and integrative care, the testing is egregiously overperformed. Now, I don't think any of this is being done with malintention on the part of the healthcare providers. But what has seemed to have happened is lab companies have been very influential in the educational model of young doctors and clinicians, and this has skewed the thinking. And I feel we're in a period where course correction is occurring as this is becoming more obvious and also as more data is becoming available. Because if you had asked me 5 years ago, I was more open-minded, for example, to stool zonulin testing. But as more data is coming in, it appears that we're seeing a diminishment of the utility of these functional medicine stool tests. So bear that in mind because it's very easy to waste a lot of time and a lot of money on tests that, as we demonstrated now with 2 studies, do not offer benefit, at least as it pertains to quantifying your zonulin over time. If you're trying to do repeat assessments with stool, you're going to want to pull your hair out because you may actually have less LPS, but that will not be reflected by your stool test. And this is where, unfortunately, sadly, sometimes what happens is someone is feeling better by every metric. I feel better, my symptoms are better, my stools are better, my brain fog is better. Well, your stool zonulin's still out of whack, so I guess you got to stay on low FODMAP. In fact, let's double down and let's low FODMAP harder. And also caffeine, maybe cut that out. Maybe that's a problem. And you think, John, that dairy is okay, but since zonulin in your stool is still elevated, we should probably cut out dairy also, right? So unfortunately, with, I think, good intentions on the behalf of the healthcare provider, we can really do damage to people without intending to do so if we're not thinking about how all these dots connect on the back end. And then finally, remember that if you do plateau at a symptomatic improvement level that is not satisfactory, that's when we integrate on top of the diet other therapeutics to get you closer and closer to your goal. In recap, the low FODMAP diet is reparative, regenerative, corrective. This is important to understand because sometimes people will say and they will claim that, well, you shouldn't do it because it is a lower prebiotic diet, and this lower prebiotic diet will starve your bacteria and is bad for your gut. And that was understandable with our level of understanding in science 5-10 years ago. But now that we have more and more data, as we just reviewed, coming in, we're seeing no, that's not true. And for people who have GI symptoms or perhaps some extraintestinal manifestations of leaky gut, like chronic inflammation, brain fog, fatigue, insomnia, it's possible that their system, their gut, would be healthiest if they, at least temporarily, reduce the load of prebiotics vis-a-vis a low FODMAP diet, experienced the repair, the regeneration, and then all the symptomatic benefits that follow from that, and then finally go into a reintroduction and aim for the broadest diet possible with the most diverse intake of foods that they can. Okay, well, this is Dr. Michael Ruscio, and I hope this helps you navigate what can be a somewhat thorny topic of the low FODMAP diet and sets the record straight for you that this is a diet, at least temporarily, that can really help move the needle with healing your gut.